sort of my role in this panel of three is to basically give you some of the details of the bill. It's not all the details, but it's sort of a quick tour. Why don't you switch next slide? So again, this was a bill that was passed in just a little more than a month ago in late March, signed by the president. There actually was two bills. There was one bill called the Patient Protection and Affordable Care Act, and then it was amended right afterwards by another bill called the Healthcare and Education Reconciliation Act. This is really the most important law that's happened in healthcare since the Medicaid and Medicare programs were created in 1965. So a couple of generations have gone by since we had reforms of this scope. The bill has been described at various points. I heard that one of the speakers saying it was 2,700 pages. Actually, the printed version is around 1,000 pages, so it's still sort of a pretty thick tome. My talk will be about 10 minutes, so I'm going to be talking at roughly the speed of 100 pages a minute. So it'll give you a sense that I'm not going to try to speed talk. I'm not one of those people who go yummy, 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 yummy. But I'm going to sort of have to gloss over some details, but I'll try to give you some of it, some of the main points. It's really the result of more than a year worth of very intense and sometimes very often very partisan debate and work. So it was a major effort. Still, as many people have said, it's really just a start. There will unquestionably be things. Healthcare legislation is constantly being amended. That's going to be the case for this too. It's also going to be something that will be implemented over the next several years. So some changes will happen soon. The federal government is already rolling out some changes. Some will take many years before they come to fruition. So I'll try to explain some of the difference. Next slide. So let's first go over what are some of the goals of the legislation. And really, the important thing to bear in mind is the healthcare system that we have today is huge. It's an industry that consumes more than 1/6 of the U.S. economy. Total cost is $2 trillion, going on $3 trillion. It affects all of our lives. Some people have described the bill as being sort of a government takeover of healthcare. It's not that. It's really trying to leverage changes and sort of poking and prodding sort of a giant lumbering elephant to maybe move a little faster, so change directions a little bit. So one of the main goals was to improve and expand health insurance coverage. Right now, about 1/6 of Americans are uninsured. The goal will be to try to sort of help really reduce the number of uninsured. The Congressional Budget Office estimates about 32 million fewer people will be uninsured at the end of this time. It's also intended to maintain and strengthen the current healthcare system and health insurance system for those people who already have access. It's trying to make healthcare more affordable and more accessible, both for consumers, that is lower people's out-of-pocket costs, as well as for the nation, that is slowly make the total cost of healthcare not quite so large. To try to gradually develop systems that are going to improve the quality of care that we have in the U.S., and to strengthen the healthcare delivery system. And what also that means is sort of more training of the healthcare workforce to increase preventive and public health care in the U.S. so that people don't become sick in the first place. And finally, an important goal was to not break the federal budget. So this is an ambitious slide of goals. Next slide. The first part, and the part that people talk the most about, is insurance reform. Some of the things that are going to happen right away is that those who have private health insurance under regular plans, insurance plans will be required to extend coverage for dependents under the age of 26. So that is, if you have a child who's not insured and your child is under the age of 26, your child could be covered under your policy. That will be rolled out over this coming year. Similarly, on the same time frame, insurance companies will be told they can't have lifetime or annual caps on insurance. That is, you can't be told after you've reached a certain expenditure, sorry, we're cutting off all care. It's going to expand the coverage of preventive health care. Furthermore, there's going to end discrimination against children who have pre-existing health conditions. That is, if a child is already sick. Right now, some health insurance companies could say, gee, you have cancer already, we're not going to cover your cancer because you're already at risk. That's not going to be permitted again, beginning later this year. Now, the bigger part that begins in 2014 is the government will begin working with the states to establish a new competitive marketplace for private health insurance plans. These are going to be health insurance exchanges. You're going to hear this term a lot, health insurance exchanges. There's supposed to be markets for private insurance. They're going to be regulated, and hopefully the goal is they'll be more competitive. There's a similar system in Massachusetts that was set up a couple of years ago. Seems to have worked pretty well so far. There'll be tax credits established beginning within the next year to help small businesses pay for health insurance for their workers. Over time, what will happen for these larger health insurance credits, there'll be larger tax credits available for individuals who have low to moderate incomes to help them buy insurance. One thing important to keep in mind, most people will keep the health-based insurance they have. Most people in the U.S. today have health insurance through their jobs, through their employer, through their union. That's going to continue to remain the major base of health insurance coverage. Next slide, please. So a little bit more about these health insurance exchanges and the tax credits. So beginning in 2014, so again, this is beginning, it's supposed to start January 2014. States will be asked to set up health insurance exchanges, and then private health plans will bid to be part of this health insurance exchange. And if so, then they can offer plans under that. Initially, people who are individuals or those who are working for small businesses will be able to purchase health insurance from these small plans. These are the people who have a hard time buying affordable health insurance right now. The system will be set up so that the rules will be clarified. People will understand a little better what their choices are, what they're getting from each plan. The health plans are going to have to meet some basic federal criteria to qualify. And hopefully the differences between plans will be a little clearer to applicants so people will understand a little better what it is they're trying to buy. One of the concerns that came up a lot, undocumented immigrants are not going to be eligible to purchase health insurance through the health insurance exchanges. Now, some of the health insurance is still going to be too expensive for many people to buy. So the federal government, and this is a big deal, will provide sliding scale tax credits for people who have incomes, roughly speaking, between 100% of poverty and 400% of poverty. So you have a sense, that's families between incomes, say it's a family of 4. Right now, a family with incomes from $22,000 to $88,000. People on the poorer side would get more tax credits. People on the higher side would eventually get almost none. But there'll be some subsidies to help people afford health insurance. Next slide. There'll be new requirements. Beginning in 2014, citizens and legal residents will have to show that they have health insurance coverage. People call this the individual mandate. If they don't do this, they'll have to pay a tax penalty. The tax penalty in the first year will be relatively modest, $95. Eventually it'll rise up to about $700 by 2016, and or 1% of taxable income. There will be various exemptions and situations so that if people are too poor or have various hardships, they still can't afford insurance, they could be exempted from these rules. Again, this is something pretty similar to what Massachusetts has already done. Seemed to work pretty well there. In addition to this, large businesses that do not offer insurance and whose employers use tax credits will have to pay a penalty per worker. And the goal of this is to try to encourage large employers to offer health insurance to all their workers so their workers don't need to turn to the health insurance exchanges instead. So there's efforts to both promote individual responsibility and corporate responsibility. Next slide. In addition, there'll be some other important insurance expansions. The Medicaid program will expand to serve adults with incomes below 133% of the poverty line. This again begins in 2014. That is for a family of 4, people whose incomes are below $29,000 a year would be eligible for Medicaid. Now, right now what happens in states is, in many cases, if you don't have children who are minors, you're not eligible for Medicaid at all. In states across the country, on average, if your income is below 64% of the poverty line, you're not eligible for Medicaid. For example, in my home state of Texas, if you are a family of 4 and you make more than $6,000 a year, you're too rich to get Medicaid. So this is going to make a big difference for health insurance coverage for low-income families.